Hello, I'm Dr. Greg Winteregg, CEO of the Private Dentist Alliance. I want to talk to all of you students out there today who are wondering what your future is going to be like as a career in dentistry. As an assistant, as a hygienist, as a dentist, where is this profession going with the rapid increase of the DSO movement? I'm here to tell you that PDA is going to help you, and I want you to become a member today. It is free. Now, why should you become a member? You're going to get weekly video updates from me, and you're going to get regular updates of our newsletters from the Alliance on exactly what is happening and how we are going to help preserve and protect the private practice of dentistry. Now, to me, the most important advantage is you are going to get access to our job board. What is that? Our private practicing members all have access to our PDA job board, which means if they have an opening in their private practice of assistant, hygienist, doctor, front office staff, they're going to be able to post it. And you're going to be able to check up regularly. And as our membership grows, we're going to be covering larger and larger territories across the United States. If you are looking for a job in any position in the office of a private practice, you need to become a student member today. It is free. Go to www.privatedental.org and become a student member today. You're going to love your benefits. Do it now.
What is up, guys? It's your boy Matt Havis back at it with Dental Student Vibes podcast. It has been a hot minute, so today we thought we'd sit down, we do a little summarization with Cole about what he's doing in his D3 clinics, everything he's learning, the procedures that's going on, his transition from sim lab into clinic. Check it out, listen to it. Let's see if your D3 year or your clinical experiences within your dental schools are comparing to Cole's. Let us know. We would love to hear from you guys. We want to see what things are like as things kind of clear up from COVID. So shoot us a DM on Instagram at dental.student.vibes. Let us know what you guys think about Cole's experience, and we would love to hear about yours. So give us a like, comment, review, all that jazz. We love hearing from you guys. So as always, let's stay safe and vibe on.
Welcome back, Dental Student Vibes. We're back at it again. Dr. Havis, Dr. Herzik, I'm Seth Kalish. How you guys doing?
Aces.
Can't complain. Things are good.
Yes, sir. Yes, sir. So we're doing a lot of things these days, super busy, but we want to talk to you guys about clinic. We're in our D4 year. Cole's in his D3 year, and Cole just entered clinic for the first time a few months ago. So Cole, let's jump right into it. What is D3 year like?
D3 year is just like you guys said. It's a lot of feeding you to the sharks and, kind of letting you on your own devices, figuring it out on your own. It's a lot all at once, but once you kind of figure it out and get your groove, get Axiom under your belt a little bit better, it's honestly fantastic. It's great to have your own schedule, be able to really feel like you're your own practitioner, be able to pull up your schedule, see your open spots, fill it with some patients, look at your active treatment plans that you have, formulating your new ones, really feeling like you're truly in the trenches and you're being the dentist. So honestly, it's a great experience thus far. Honestly, wish I had more hours in a day. I think that's my biggest complaint right now. I feel like I don't have enough hours in a day to do all that I want to do.
Right. So what do you think takes up most of your time? Like, since you're saying that you don't have enough hours in the day, I mean, clinic is so busy, you're not only, the biggest thing is that you don't have an assistant.
Right.
If we had assistants, we could go twice, triple, quadruple times as fast,
Oh yeah.
You have to literally set up, break down the room, but you also have to hold your own suction while you're drilling with the other hand. So
With a mirror in your hand.
Yeah.
You have the suction bent, hooked around one finger like this, and the mirror is like getting all foggy, and you're just trying to drill and you can't see anything.
Yeah.
So,
I know, literally. Yeah, no, I think my biggest, like I said, for the time is we have 7 a.m. class too, Monday through Friday. So that's the biggest thing. It's, if you have a really busy day and class is going to go from 7 to 7:50 to sometimes 8 o'clock, and you have huddle at 8 o'clock, and huddle could last a while. So you sometimes need to set up beforehand if it's a big procedure. So in the morning when I was going to have major surgery, I had to get there really early at 6:30, set up, jet over to class after I set up, do class, run back over, do huddle, then set up the rest of the way and kind of plan on my day. And then I had a 1 o'clock patient too. So, it's pretty busy. It's a packed day. And then by the time 5 o'clock rolls around, you're exhausted, but we still live an active lifestyle. So we want to decompress, then go to the gym. But then you have so much other things that you need to do. And it's already like 8 o'clock then by all that time, all that rolls around. So, you feel like you need another 2-3 hours of productivity throughout your day. But where are you going to find that? And still sleep.
Yeah. And no, you don't need to sleep. What are you talking about?
Oh, that's what caffeine is for.
Yes. I do
But
find myself drinking a lot more coffee. So
yeah, I know exactly what you're saying, because it's a lot of do stuff now rather than just sitting around studying, which is also tiring. But it's like you're running around, you're treating patients, setting up, breaking down, you're doing all this stuff, and then you have to like find time for lunch, where your lunch could just be you sneak into the wet lab and have a protein bar without anyone looking, and then finish chewing it as you're walking in to see your patient, as you're doing your lab work, pouring out models, because you got a denture coming in or whatever. So it's just a lot of a lot of different things that lead to just like time consuming activities, and then you can't do what you would normally do. And then it brings us to the point, like, this is where you learn to appreciate your lab and appreciate your assistants someday, because like for a denture you have to do everything yourself. Meanwhile, you take an impression, send it to the lab, and then a denture magically appears like 2 weeks later. And it's just you just learn, like, setting teeth stinks, and if people get paid to do this, let them do it. We just learn to appreciate it here. Because have you done a denture case yet?
not a denture case yet, but I know what you mean about, kind of force feeding yourself really quickly in the wet lab. I had a day where I booked myself 3 patients, and it was a little too overzealous, but I said I was going to do it, and I did it, but it was really busy, and where I booked myself an endo consult with a COE and then another endo consult the same morning, knocked all that out. And then in the afternoon, I had a perio maintenance plus perio consult. So I tried to make sure that I got all that done. And my day was so busy that I ran into the cafeteria, and it literally was a vending machine lunch. I didn't have time to eat the food that I had. I had like 4 minutes, and in 4 minutes I had like 2 protein bars. I gulped those down, and then I ran right back over, and I had my afternoon patient. So you just get it done.
Right. So let's break down what clinic is like for all of those that are listening that don't really know what clinic is like. So end of dental school, you start seeing patients, and a lot of times, I mean, it's so different at every school, but we have our own operatories, and we got our own chair, and basically you treat your patients, you do your exam, then you do your treatment, and you have a preceptor in the room who's basically a doctor who's there, who's either part-time or full-time, and they'll help you out. They'll kind of walk you through stuff, give you, I mean, a lot of times the hardest stuff is the treatment planning. They'll walk you through the treatment planning, and then you also have specialists coming around here and there. And so you'll have like consults as if you sent it out to an external provider. But, sometimes you can't do everything at a dental school, as we all know. So you do have to send it out to external providers. And I'd say probably the biggest thing, besides like you having to do every step of every process except for like calling the patient most of the time, is it's really like you're touching every single step. Like we already said, break down, put everything together. You have to like get all of your materials in order, all of that sort of stuff, and then you don't have an assistant. And the other thing is you have long appointments, so you're sitting there with the patient the whole time, and you got to learn how to become a people person and talk to the same person for 3 hours, make small talk, this and that, all that sort of stuff.
Right. In the waiting, I mean, that was the biggest thing for me too, is, it's been pretty good thus far, because, it's kind of the beginning of the year. Everyone's kind of on different paces and schedules with seeing patients. But once we really start getting up to speed and everyone starts really seeing 2 patients every single day, it's going to get crazy with the waiting. I need my preceptor, but everybody else does at the same time. So what I try to do is I've been really good about my time in that I really only have them come in twice if it's something simple. Come in for a start check in the beginning, say hello to the patient, and then done after I've done everything. I've already planned their appointment. I've already written a note. I've already completed their treatment for the day. And I've typed everything up and I've got all my ducks in a row already so that they're not constantly coming back there, because I feel like that's another piece that at the beginning, you don't really have that know-it-all to really get everything done so that they only really need to come in twice on, like, say, a perio maintenance or a recall appointment. I mean, of course, if they're going to come in for surgery or, like you're doing some fillings and they need to check every little thing, that's a little bit different. But if it's something that can just be avoided where they come in real quick and then they come in at the end, it's great to have everything in order done so that when they come in, you have everything you can present it to them. So you're not wasting their time and then wasting the patient's time too, because they feel like, oh God, again, another thing they have to come in here for. That's another big thing with the paperwork. And that's a lot of things. I mean, you don't really have that in a lot of private practices, all the paperwork that we have to do as students. We have to fill out a lot of forms. We have to document literally everything. And then we also need, on top of that, a preceptor to swipe off every little thing that we do. I mean, I can't tell you guys how many times that when they start doing, I'm sure you guys ran into this too, when you start doing treatment plans, you literally need them to swipe once, click patient accept, have them swipe again. How many times the preceptor will just quickly swipe and run out of the room, forgetting that they need to swipe one more time seconds later. So I think that's another big thing.
You wait in line more, you're D3er than you do at Disney. Like, you really do. I remember that now. Like, it's a struggle bus, because you'll be sitting there and oh yeah, doctor's coming, whatever, and you're just sitting there, patient staring at you. She's like, can we do something already? And and you're just waiting for the start check. Doctor's coming, no, don't worry. And the doctor's like jogging back and forth, swiping and taking off again. Like, it's a struggle. I feel for you, because in your fourth year, you kind of you move past that, but it's a struggle, definitely. But I mean, like, again, like, you just make the most out of it. So, like, you could get stuff done, like, going while you're waiting for, like, start check or, like, treatment plan swipes or whatever. You could easily start doing those other things. Like, I used to just, like, if I was doing a COE or whatever, and I would just start looking in the mouth through head and neck exam. Nothing that you can't undo, like, just say, oh, I didn't touch the patient, whatever. It sounds bad, but, like, I would just get moving, because I would want to start and finish. I would try to finish a COE in one appointment. And you never know, if you're doing a COE and you got to wait for, to take your FMX, and there's 4 people in line for an FMX, you'll be waiting all day for this thing, so you complete everything up until that point, make that your last thing, if that was the case, and you do that. I mean, it's just, it's about using the time wisely, and you get to plan. I think the hardest part about clinic is if you try to book, like, double book or something like that, and you don't have the instruments you need because you use them on your first patient. That's tough.
Yeah, I've had to borrow too.
Sure you can.
Yeah, you just
wipe them with your cabinet.
Yeah, you wipe it with your scrub. Just take it like this and keep going.
We're kidding. Yeah.
You're gonna have to get a couple basic setups. I've run into that problem a few times now. Like, on the days that I book 3, we're only given like 2 or 3 basic setups. So then, God forbid, the autoclave isn't finished, then I'm like, oh God, well, what do I do now just for a basic setup? I just need a damn Explorer.
Right. I think what we need to do is we need to make industrial grade autoclaves and just sell them to all the dental schools, because we put a beating on those things. They run 24/7. They have to, because it's not meant for 10 different people to have to run instruments all day long.
Well, when you move to central sterilization, that's what they get.
Oh, really? They have, like, the bigger ones?
Yeah.
Okay.
Yeah. Then they're, like, super expensive. But so, Cole, so what would you say is, so how long have you been in clinic now? It was like,
So we're now in middle July. It's been about a month and a half, 2 months.
okay. So you've had, like, probably most experiences by now. What do you think is, like, the most rewarding thing so far?
Most rewarding thing so far, honestly, I didn't think so. I'm not probably going to do a lot of it as a private practitioner, but doing SRP, I think, has been the most rewarding, believe it or not, because some of my patients that I've done my SRP on, they've just had a ton of calculus, both sub G and supra. And I mean, it's just crazy to just see the difference. I had a D2 come in and assist me one of the days as one of his sign-offs, and just to see the transition of the patient, I did their full mandible the same day because the man requested it, and just to see the difference between how he started and how he ended, and just the cleanliness that we got him after was phenomenal. And I think the second thing that I can attribute that to is surgery. I had another man that was just, like, crying in pain at an NPS appointment, and the next appointment I said, we're going to do your COE, and if I get the seal of approval from the oral surgeon, we'll get that tooth out. sure enough, we got the seal of approval, and rather than finish the COE, we took that tooth out, and oh my God, that man practically kissed my feet, once we took that tooth out. So I think that was super rewarding too. And the fact that I could keep him numb and he didn't feel anything other than some pressure was another big thing, because it's pretty challenging. It was a molar.
Right. So you're saying that seeing the, I guess, like the before and after, the transition and the health of the patient, and seeing how they progress and how you're helping them move forwards with their overall health is
Yeah, I
really
think so. Honestly, that's a good summary. I think just seeing the before and after, and not only in the before and after in the visual, but the before and after how they feel. I think that's super important also.
right.
Mhm.
And for those listening, an SRP is just like a deep cleaning in a nutshell. So, but it's definitely, yeah, you can make a huge difference in patients' lives. So now that's the most rewarding thing. What do you think has been one of your biggest challenges so far?
Ooh, biggest challenges. I think you hit it right on the head when you're talking about treatment planning. Coming up with accurate treatment plans, especially for complex cases. I think in comparison to a lot of people in my clinic, and I'd probably even venture to say a lot of the people in most of the clinics at my school have had the most number of COEs. I had probably the first 2 or 3 weeks, I had probably three COEs a week for the first 3 weeks. So I had like 9 COEs right off the bat that I just had to put together. And of those 9, about 2 to 3 of them were very complex, to where after everything is said and done, they need between $4,000 to $6,000 worth of treatment, putting everything together, and not from expensive things either, just like putting hodgepodge things all together to make them an accurate treatment plan to treat everything that they have, and to just kind of like properly phase and sequence that. That's another thing that we have to do in school, and I'm sure other schools have to do it too, to put it in a proper phase and sequence based on, is it diagnostic information we're doing? Are we doing disease control? Is it definitive treatment, or is it just, maintenance? So putting that and staging all of that in the proper sequence that we need to, and then coming up what's going to be the best option for the patient, taking a lot of things into consideration, their age, how much they're willing to spend on something, their pain tolerance on, you know what I mean? Like putting all that together and putting something together that they're going to accept. I could create this Mac Daddy treatment plan that's phenomenal dentistry, but at the end of the day, are they going to say yes and let me do it? Or is the school going to let me do it, because some of it's a little bit more complex? So I'd say 2 or 3 of my patients have super complex things that, to be honest, I've had 2 preceptors tell me on one patient in particular, this should have never been a school setting patient, but here we are, let's try to do what we can.
Right. And I understand what you're saying about getting the patient to accept the treatment plan. And I was talking to Matt about this today. And I've heard a lot of people, case acceptance and case presentation is like one of the biggest things. The first thing that you have to do with case presentation doesn't even start with the case presentation. It starts with walking in the door and establishing trust and rapport, right? But also like patient education helps. But I think the absolute number one thing is trying to get the patient to understand like the value of the treatment. Like how, if they value a car, I'm going to get a new car, like, next week, they're not going to spend money on dental treatment or something like that. But if they understand like the value of spend $10,000, get your teeth fixed, and you help convey the value of the dentistry, then they might have a stronger consideration to getting the dentistry over the car. You get what I'm saying?
Right.
So it's really like conveying like value.
Mhm.
You could say that about anything, it's just trying to help the patients understand, but this isn't, you could say same thing for a car salesman. They're trying to get you to understand the value of the car, but here we are like doing something serious that can seriously affect patients' health. So,
Yeah.
You don't really have to sell, like it sells itself. It's just how you kind of bring it all together and convey it to the patient.
And everyone's different. I have a patient that, who would think that I treatment plan it's now changed. It's 4 gold crowns and a gold 3-unit bridge. Who would ever think a patient would go for that? But I have a gentleman that that's all he wants in his body. He said, if it's not gold, it's not going in my mouth. So everyone's different. You know what I mean? And I would have never thought to treatment plan gold for this man's mouth had we not had this good conversation about these gold inlays and onlays that he has in his mouth currently. And he goes, oh man, those have been there for 50 years. They're my favorite things that I have. Nothing else in my body is going to be anything but gold. So, hey, it's learning those little quirks like that. Other people be like, hell no, I'm not having gold in my mouth.
Right.
Yeah. And honestly, like when you see, I mean, for me, I can just appreciate the gold in the mouth. Like I've seen patients where they have just beautiful gold measures. I'm like, how old is this? And they're like, I don't know. I think it's from like the 70s. And I'm like, what? And you look at the margins, like it's almost like wine. It just gets better with age. Like the margins, like it like fuses to the tooth, like decay, like there's no form of decay getting under that thing. And it's just incredible, just beautiful work and everything. But again, it's also not tooth colors, the way culture works and society moves away from that stuff and everything, even though it's probably one of the best materials you could put in your mouth. It's truly incredible. But the nice thing though is, pro tip, cut the crowns off and sell them to the pawn shops. You get money for it.
You're supposed to give it back to the patient.
If the patient says, hey, if the patient wants it, it's their property. But in my experience, I've cut off 2 gold crowns on 2 very old people. They could care less. They're getting their AARP money with their cards and everything. They got Social Security coming.
Man.
They don't need the crown. They're like, I'm not doing this. And I was like, I'll take the crown off your hands. Sold at the pawn shop, $70, just like that.
So what we're saying is Matt found his new side hustle.
I'm never going to Matt as the dentist.
That's okay. Well, if
I'm
you
gonna
got
walk
gold,
out and I'm not gonna have any teeth left. He's gonna take all my teeth and
do you have
say,
any gold?
no.
Your teeth are safe then.
He's gonna take one of my kidneys.
I hear they go for maybe a piece of liver too. I hear that goes for a lot.
Yeah.
But yeah. So I mean, definitely things to think about when it comes to like gold restoration, stuff like that.
Matt's message here. You find a patient with gold crowns. You try and take their gold.
I have a better one.
That's Matt's message.
You got a patient with gold crowns, send them my way instead. Anyways, all right, we'll get back on topic. I just had to joke around a little, but
oh man,
like honestly though, like I see what you're saying. I found no matter where you are in clinic, no matter what city you're in,
he's gonna say no matter where you are, there's still patients with gold crowns.
There's still gold out there, and I want it. No, but realistically though, like it also depends. Like no matter what treatment plan you're trying to sell, no matter how much money it's worth, the main goal is you have to be able to like reach the patient, because some patients are going to value their mouths more than others. And that's extremely important, because my favorite example to use is like for instance, I'll use my patient today, has like a hairline crack in their first premolar, and we're gonna have to do something about that. And she's like, oh no, it's fine, it's not bothering me. I said, what if you had like a growth on your finger or an infection on your finger? You're just gonna tell the doctor, cut it off. I don't need. I got 9 others. And like, no, I would get that fixed. Okay, I said, what about your tooth? I said, why? Because you got 29 other teeth? I said, think about it. I said, you're going to lose this tooth and you have a big like, black space right there. I said, is that something that you would be interested in? No, because you're not in competition with other dentists trying to sell treatment plans. You're in competition with Best Buy, gas station, whatever, like anything that they could buy on a day-to-day basis, because somebody would rather take that $1,000 that they spent on like a crown or whatever and put it towards a big screen TV. You buy the tooth that's in your mouth, you forget about it. You just brush it every so often. Like that's it. Like, it's like a patient could easily appreciate a big screen TV to watch the NBA finals on versus the tooth. It's like they would spend the money because they have to, because they're responsible. But some patients would be like, I'm okay with just losing the tooth. Then I talk about, okay, so you lose that tooth, the one below it super erupts, it's going to affect occlusion. We pull that tooth. Then the one in back drifts into that one, then you lose that tooth. And I said, you see how it like domino effects or whatever? And you have to simplify it to the patient so they can understand, because they didn't go to dental school, but you explain that to them, and all of that stuff hopefully makes sense, and that you let them make a more well-informed decision about their body. And I told them, I said, whether you choose this or not, I'm going to get my 8 hours tonight, but I would like you to be able to go home and be comfortable without pain, knowing that you have a healthy mouth and that everything has been taken care of. Because what's going to end up happening is you're going to wake up in the middle of the night on a Saturday night, and you're going to be in throbbing pain. You're going to call the office. And I said, I'm 2 beers in, I can't come in, and you're going to the ER. And I said, all they're going to do is they're going to charge you a lot of money to put you on antibiotics, and then you're going to be in my office on Monday, where I have to fix a very large problem worth a lot of money, rather than doing a filling right now that you just don't want to pay $100 for, rather than having to pay for the $600 crown, or I have to extract the tooth and then place an implant. If you have to do all that stuff, it's like you let the patient know now rather than putting it off. Going to the dentist isn't the most fun thing in the world, no matter who you are. So just try to make them aware and make it worthwhile. Because if you don't, it's ultimately like, it's not a disservice from you to the patient. It's just, if you communicate effectively and try to get on their level in terms of their, knowledge of the dental field, it can help. And it really can make a difference in the treatment that they'd accept and the treatment like that they're aware of. So that's my take on it. That's what I had to do that today, actually. I did.
So moral of the story, don't call them on Saturday night. And if you got gold crowns, find somebody else.
That's a good summary. Very crude,
Yeah.
but it's a good summary.
All right, Cole. Any last words for our listeners about starting clinic?
I think don't be afraid to just jump right in. I think the biggest thing that I would take away, even just from my first 2 months, is that I haven't been afraid to start anything. I haven't been afraid to jump right into my first crown prep. I already have that under my belt, only a month and a half, 2 months in. First couple extractions, first filling. Don't be afraid to not take it slow, because the best way that you're going to learn is by doing. Especially in the beginning, you're going to get a lot more help than you will later on, which is great. Take all the help that you can get. They have good tips. Your preceptors are there for a reason. The specialists are there for a reason. And all those experiences are there for a reason. I mean, you don't really just do something for the first time after reading it and being an expert in the textbook, and then go to do it and expect to just knock it out of the park right away. There's going to be some, they always say there's growing pains. There's going to be some trial and error. You're going to learn what works, what doesn't. So where that, extraction that took you 20 minutes before, next time you do it, it's going to take you like 4, maybe 5, if you just knock it out real quick, because you learned along the way. So don't be afraid to push yourself and to really apply everything you've learned in practice.
Love it.
Well
Love
said.
it. All right, Cole. Signing off. Dental Student Vibes. Thank you guys for listening. Catch us on Instagram, Facebook at dental.student.vibes. Peace out.
Bye, Lon.
All right, guys, it's your boy Matt Havis. That's all we have written for our episode with Cole, checking in with him, doing his D3 year, getting that update, hearing what he has to say, hearing the procedures he's doing. We want to hear from you guys. Let us know what you guys think. We had a minor siesta. We're back and better than ever. We're recording. We're putting out episodes, and we are running. So let us know what you guys think. Let us know if there's any episodes that you guys would like to hear, any guests that we can find for you, any topics. We want to find these things for you. So as always, follow us on Instagram at dental.student.vibes. Let us know what you think. Give us a like, comment, and review, and share it with a friend. We love to get new listeners. So as always, stay safe and vibe on.